Flakka is Dr. Damon Raskin, a board-certified internist and addiction medicine specialist. So you said, doctor, that this has been seen already in other parts of the country, and it's just a matter of time before we see it here in California.
Absolutely. So I want to get the word out now. It started in Florida. It's starting spreading up the East Coast in New Jersey, Oklahoma, Tennessee. It's been in Texas, and we know it's coming to Southern California.
You can buy it over the internet.
It's easy. You buy it over the internet, or you can get it from a dealer. It's very scary. It can come in the mail. It's not labeled. It's odorless. You can't tell what it is.
What does it do?
So it causes what's called an excited delirium. It makes people think they're super strong. It causes violence. It causes overheating of the body. So people will take off their clothes. They'll stab people. They'll cause self-harm. They think they have superhuman strength. And so police have to sometimes tase them or shoot them because they can't be stopped.
So it's similar to bath salts in a way, and we've seen what's happened with bath salts here. That was a new phenomenon that was just a couple of years ago, and people were like literally eating other people's faces off. I mean,
Absolutely.
It's insane.
It's insane. And in fact, one of the reports I saw calls it $5 insanity because it's cheap. It costs about $5 or less a hit, and it causes people to go insane. It is another derivative of a bath salt. So we're seeing this sort of synthetic design happen where one drug is found and they can detect it, and so the designers of the drug, wherever they are designing something else and something else. So we continue to see this problem.
This is legal.
No, this
because
particular ingredient is currently banned in the United States, but they're continuously trying to modify that, so you will see what happens.
Now, I mean, this sounds like it just turns people into murder machines, but can one hit of this send you to the hospital? I mean, what is the dosage like if you're buying this stuff on the internet?
Sure. So one thing that's important to realize is you don't even really know what you're getting. This could be cut with cocaine, this could be cut with heroin, and the dose is very hard to figure out. So if someone's used to doing cocaine, for example, half a gram of cocaine, you do that much of this Flakka, you could be in the hospital. You can overheat, you can go into kidney failure and need to be on dialysis, and you can definitely get permanent brain damage, as we said earlier.
How difficult is this for emergency rooms and physicians in the sense that you're saying now that all of these drugs, I mean anything out there right now, basically are being changed synthetically so they could be laced with just about anything under your kitchen counter now, right?
Absolutely.
And it causes a variety of different reactions.
Symptoms.
So how do you even know what you're dealing with?
Exactly. All we do is we try our best to get the history from whether the patient will tell us, whether their friends will tell us. We try to get what they're taking. We get urine tox screens, blood tests to see what we can find, and then we do the best we can.
If we see a growth in popularity of these synthetic drugs, I mean, right here in California, for example, pot is now, you know, on its way to becoming legal, and it's available everywhere. Does it make it less cool, and do kids want to go out and find the next drug?
I think that's exact. You hit the nail on the head. I think we're always looking for that next exciting thing to do. And so, yeah, pot is just, you know, pot. But the exciting new synthetic drug that they have to say, you know, this is alpha PVP and has a cool street name like Meow or Crocodile or whatever the next name is unfortunately the sad part of what this is.
And by the way, some of the derivatives of marijuana now be put in these little vaporizers, right? And you can smoke them through these vapor...
these e-cigarettes, vape pens. And you can do that with this Flakka as well.
So you can snort it, you can ingest it, you can
swallow it, you can inject it, you can snort it, you can smoke it. So you can get it in any way, and it causes as much harm. But that vaping actually causes the most damage because you're getting it right into your bloodstream. It goes right into your lungs and right into your bloodstream.
Oh. Gross.
Yeah, I mean, it's amazing to me that people try this. But what is the high? I mean, I know what it looks like on the outside, that they're losing their minds, but
well, it's a rush of euphoria because what happens actually chemically in the brain is you get this big release of dopamine, which causes, that's the pleasure chemical in your brain. That's the chemical that gets released with sex or gets released with a big rush. So that's what they feel, that excitement. But you can see the other problems that come along with that.
Yeah.
Dr. Damon Raskin, I'm sure we'll be talking about other
Flakka
types of drugs that will be springing up here.
Happy to be here. Thank you.
Thanks so much, Doctor. Director Cam.